Good evening, everybody, and welcome to the November Winnebago Community Update. I am Emily Longuski, the Communications Manager for the Winnebago Comprehensive Healthcare System. And today we'll be going over our COVID updates for Winnebago and our tribal organization updates. First off, we're going to go to our nurse practitioner in the outpatient department at 12 Clans Unity Hospital, June Myler, to give us an update on COVID testing at 12 Clans Unity Hospital. June?
Hi, everyone. First of all, we're going to go over the testing, both courtesy testing and critical testing here at 12 Clans. Courtesy testing is the testing that most everyone is familiar with, and that's the drive-up clinic testing here at the emergency entrance of the hospital. The COVID-19 testing through the outpatient drive-up clinic can be utilized for patients who do not need emergency care or have little to no symptoms, okay? The COVID-19 testing is done by appointment only, which means that you have to call the following number and schedule an appointment. The number to call is 402-878-3404. The testing times are Monday, Tuesday, Thursday, and Friday from 9 a.m. to 12 noon, and then from 1 p.m. to 2:50. There's no testing done on Wednesdays or on the weekend. Okay. Let's see. The patients who have COVID-19 exposure should not get tested until about 5 to 7 days after the initial exposure, because sometimes it takes that long for the antibodies to build up. This is also because you can test negative if you get tested too early. And you can continue to test if needed. If you're symptomatic and you test negative, then you can be retested 2 to 3 days later, because sometimes it can take up to 14 days before you'll actually show positive on that test. The critical testing, which is COVID-19 testing done through the emergency room. This is reserved for patients who are having severe symptoms that include trouble breathing, persistent pain or pressure in the chest, new episode of confusion, inability to wake or stay awake, and any bluish lips or facial features, okay? This ensures that ER resources are allocated to the community members who need immediate attention. The emergency room is open 24/7. This also helps to ensure that emergency medical attention is available for your family, friends, and loved ones. So something that we want to touch on briefly is testing that's required for traveling now. If you need a test to travel, it's imperative that you let your person know that's doing the testing for you know this, because we use a different type of test called a PRC or PCR test, actually, instead of our rapid antigen test. So typically this takes about the same amount of time to result, but it needs to be done 36 hours before you travel. So with the holiday weekend coming up next week, we just wanted to make sure that we let everybody know the specifics on this. And then typically if you're flying or like going to Hawaii or Mexico or something like that, if you're vaccinated, you need to make sure that you've had that second vaccination at least 2 weeks before it's time for you to travel, because it takes about that long for it to build up and be effective in your system. So, and that is all I have for today.
Thank you, June. And real quick, can you talk a little bit about the timelines from when somebody should expect their results from when they get tested to when they're notified and how they're notified?
Sure. Yep. We will notify you via phone call. Typically, if you're positive, you'll be getting a call from either a nurse practitioner or a doc. And typically this occurs anytime after you test up to a 24-hour period. We like to get everybody notified same day. Unfortunately, it doesn't always work out that way. So absolutely everyone should be notified within 24 hours. You will also be notified if you're negative, and that will take place. Typically, the nurses are taking turns calling patients and letting them know that they are negative. And then we try not to have everybody calling into the clinic to ask the results of their test, but absolutely, if you haven't been notified by the end of the day, feel free to call and we will try to get those results for you.
Okay, great. So it could take, but basically what you're saying, up to 24 hours. So
Up
if a
to
patient
24
maybe
hours. Yep.
gets their test at 9 a.m., they might not get results by 10 a.m. if that's what they're needing. It might take a little bit longer, correct?
Absolutely, yes. Yep. 9 a.m. to 10 a.m. would be pretty much not going to happen. It definitely takes a few hours later in the day.
Okay, great. Thank you so much for that information, June. And thank you for joining us today. Now we are going to head over to Mona to do our community update. Mona?
All right. Good afternoon. Sorry about stepping in a little bit out of order. So we'll just go ahead and get started with our presentation today. Thank you all for joining us today. And we have the updated information as of last week. So I don't have the vaccination information up to date just yet as of yesterday. So working on that. So as of yesterday, we had reported 2 new positive cases with 10 current active. So it brings us to a total since last year of 500 related to COVID-19. 483 have recovered, and we currently have 9 households in quarantine. And so for a little while, we're going to have these 2 different vaccination rates. Because I know when you see the lower one, you probably get depressed like I do, but we're still doing well. So we have 78% of 12 and older are vaccinated with at least 1 dose. And then right now we stand at 64% because, as you remember, our 5 and older population has just started to be vaccinated actually yesterday. So I'll have those up-to-date vaccination numbers after today. So I'm sure that number will just climb, and we're taking appointments, of course, and December 1st we'll be at the public school again. So total positives since COVID-19 began, so back in April 2020 when we had our first case. So the majority of our positives have come from the 0 to 19 years of age, which is about 27%. Followed by our 20 to 29 years of age at 25%, and then 30 to 39 at 16%, and 40 to 49 at about 15%. And then roughly our gender breakdown is 54% female and 46% male. So this just gives a different breakdown looking at the age again. Since our vaccination clinics began earlier this year in January, so we have our positives still are 0 to 19 years of age at 30%, and then followed by our 20 to 29 years of age at 21%, and then roughly again the 30 to 39 at 17%, and 40 to 49 at 15%. And then I think the breakdown looks exactly the same at 54% and 46% being male and female. So since January of this year to present, the majority of our household cases or our positive cases have come from positives within the household or close contacts, followed pretty closely by our, not closely, but close enough, our social gatherings. So those could range from anytime going outside of to restaurants and other activities. So this is looking at April 2020. So you can see the isolated cases are 221, and then 278 are linked to a positive case. So you can see the cases over time from April when we first got our case, and then the peaks and valleys over the last year and a half, which is where we're coming. We've seen another spike there in the end of September and slowly starting to come down here now recently. So this is showing the COVID-19 positive cases, the non-vaccinated versus vaccinated since January. And so you can see 75% of our cases have been unvaccinated individuals, which 2% were vaccinated with at least one shot or were not considered fully vaccinated, and then 23% were actually fully vaccinated. And so this just shows the actual number instead of the percentage, which 145 have been non-vaccinated, 45 have been fully vaccinated, and then 3 were vaccinated with at least the initial shot or not considered fully vaccinated. So to give you an idea of what our demographics for the vaccinated population is, so you can see the majority of our vaccinated population is 19 to 29 years of age at 20%. And then it gets pretty close with our 50 to 59 years of age, 40 to 49 years of age, and 30 to 39 years of age being 14% apiece. And then our females are about 56% of our vaccination, and then 44% of our males. So the breakdown for our unvaccinated persons in Winnebago, I didn't add the 5 to 11 yet, but you'll see them in the next very last slide. So our unvaccinated, about 31% of our 12 to 15 years of age are unvaccinated, followed by our 19 to 29 years of age at 25%, and then our 30 to 39 years of age at 14%. And then our 52% of the males are unvaccinated, and then 48% of those that were unvaccinated are females. And so this just gives a breakdown of the percentage in each age group. So as you can see, 5 to 11 right now is at 0%, but we did have that clinic with a little bit of people yesterday, so that number will start to grow. But you can see that our elders at 96% of 70 and older, 92% of our 60 to 69 years of age are vaccinated, 90% of our 50 to 59 years of age, 84% of our 40 to 49 years of age, and then as you can see, it starts progressing a little lower. So just make sure you sign up and call 878-2258, or of course the website, and you can get on the waiting list and we'll get you an appointment. And December 1st is our very big clinic, so we have a lot of space open still.
Great, thank you, Mona. And just to reiterate, so we're not having a vaccination clinic next week since it's Thanksgiving, and we will not have a clinic the week of Christmas, correct?
That is correct.
But you can call the 402-878-2258. We are hosting, as Mona said, a larger vaccine clinic on December 1st. So not next week, but the week after that, and that will be at the Winnebago Public School. And that clinic will be for ages 5 and older. So get your kids signed up. We're also doing booster shots too, correct, Mona?
That is correct. So your first shot, your second shot, or your third shot, we're all ready for you. And your flu shot.
What? Oh, and your flu shots. There you go. And we have gotten the question if individuals have gotten the Moderna or Johnson & Johnson vaccine. Our clinics are strictly Pfizer, but if you're looking to get a booster and you've gotten Moderna or Johnson & Johnson, you are able to get the Pfizer booster through our clinics, correct, Mona?
That is correct. So we just received that guidance last month. So we did have a few people that came in the month before, and unfortunately we were unable to provide that at that time because we were waiting for FDA and CDC. So, but now you can get that third shot through us.
Great. So again, the number is 878-2258. I believe it has to be at least 6 months if you got the Moderna for your booster, and also 6 months for Pfizer. But if you have any questions, I'm sure the Public Health Nursing Department can schedule you and answer any questions you have. So give them a call or go through our website at www.winnebagopublichealth.com/vaccine, and we can answer your questions and schedule your appointments. If you do have any COVID-related questions and you want us to answer, or any of our participants here to answer, you can email your questions to covid@winnebagotribe.com, or message them on our tribal Facebook page as well. And we will do our best to answer those during our monthly live updates as well. So thank you very much, Mona. And next we will go over to Little Priest Tribal College with an update from Manoj Patil. Manoj?
Good evening. Thank you, Emily, for this opportunity. Want to wish everybody a happy Thanksgiving. Stay warm, and have a safe gathering with your family and friends. We have a few updates from Little Priest Tribal College. The first is the spring 2022 registration is open. Again, I want to reiterate to the community and the listening audience that we are offering free classes, free textbooks, free laptops for new students, and so on and so forth. So again, this is then Black Friday deal still going on at Little Priest Tribal College. So don't miss out on this opportunity. We have to promote education. Learning cannot stop. So I've been a big proponent of that. So I really, really wish that all our community, traditional students, non-traditional students, lifelong learners, to take advantage and to take 1 or 2 courses here and there, or to be a full-time student. We also have free dorms available for our residents, our Winnebago community members. And of course, there are some restrictions with to stay in the dorms. As you might have heard through the grapevine, that Little Priest Tribal College is planning to offer a CNA program. That program is planned for spring 2022. We are working with a few kinks in the system, but as soon as everything is ready to go, we will be doing a big Facebook Live update. And Dr. Lori Broberg is she's the VP of Vice President of Teaching and Learning. She's the point of contact for this. I really, really want, once this is ready to roll, I really want our community to take advantage. This is in high demand. We are also want to give our pinagigis to the 12 clans for donating the beds and support and advice as we roll this program. Also, this fall 2020, we started the Cannabis Studies program at Little Priest Tribal College. So we are continuing to offer more courses on cannabis studies in spring 2022. And we also have started rolling the CIS, the Computer Information System courses. Again, these are the courses where you do not have to be a traditional student to get a degree. If you want to learn, for example, an operating system or advanced Excel, things of that nature, you can take it as a standalone course to take advantage. So this is a big, big deal for our community. We want to make sure that we promote education, and we want more and more students to graduate and stay on our community, in our community, and support our community. That's our ultimate goal, and we are striving really, really hard for that. I just also want to thank our board of trustees. They have been working diligently. They just had we had our board retreat, so just want to thank them. And I also want to thank our faculty and the staff for continued efforts during this pandemic time. In terms of vaccination, I believe the latest number was around 82 to 83% of our employees have been vaccinated. And if you are a current student at Little Priest Tribal College, we are offering vaccine incentive of $250 to our students, but they have to be current students. For more information, contact Yati Muhammad. She's the Director of Financial Aid at 402-878-2380 for more information. Again, I want to wish our listening audience, everybody, a very happy Thanksgiving, and stay safe. And Pinagigi from Little Priest Tribal College.
Thank you, Manoj. And last but certainly not least, we're going to go to Willie Bass with an update from Ho Chunk Inc. Willie?
Good afternoon, Emily. Thank you. And thank you to Mona and June for those updates around COVID and the vaccines. And, that's really helpful information. And to a degree, it's comforting knowing that our numbers are trending in a positive way. And so I just want to say Pinagigi on behalf of Ho Chunk Inc. and the community for all your hard work and your diligence, and very informative, very professional. And so I just want to say thank you. And then also I wanted to say Pinagigi to Manoj for the update from Little Priest Tribal College, for sticking it out through the pandemic and being very innovative in how to keep education alive and at the forefront, and keeping it important as a priority in this community. So I want to say Pinagigi to Manoj and for your leadership, as well as to your staff and for all the students who keep the organization running. So I just wanted to start off by saying that. Thank you. For Ho Chunk Inc., we just have a few updates that we would like to share. And one of them you may have seen already. If you have a Facebook account, you may have seen the video around cultural well-being. It was a video that was created alongside with Ho Chunk Renaissance, as well as Garen from the Tribal Communications Department. And it was a huge celebration that was captured on video. It was the Green Corn Harvest Dance event, and so it was a very good turnout. And so the video, it was fairly new, so if you haven't checked it out yet, please do so by going to the Ho Chunk Inc. Community Engagement Facebook page, and you can view the video there. You might also see some familiar faces, some family and relatives, and we also had some speakers. So shout out to Blue Lewis St. Cyr from Ho Chunk Renaissance and the staff for helping making that event a success. And we look forward to continuing that event on an annual basis. And it was very fun, and it helps keep our Winnebago culture and language alive. So Pinagigi, thank you. Check out the video. The other update that I have is we are currently recruiting actively for our ambassador program. And an ambassador is a part-time worker for Ho Chunk Inc. And it's a very flexible position. The hours are very flexible. The requirements for education is a high school diploma. And it's a great opportunity if you're just trying to find some part-time work. Maybe you want to be a full-time student and also have some part-time work. Please inquire. We have lots of ambassador positions open, and you can find those by either going to our website at www.hochunkinc.com, as well as reaching out to Janelle Decora, the program manager, and her email address is jdecora@hochunkinc.com. So to learn more about that and to hopefully become an ambassador and start that journey with us, please apply. And then lastly, I just wanted to do a quick shout out to our fairly revamped program called the Academic Development Program. It's for 7th through 12th graders. So if you yourself are a junior high or high school student in Winnebago, or maybe you have a family member who is of that age and in that grade, please check it out. You can, again, go to our website, hochunkinc.com, and we would be able to potentially provide grant funds to you to attend an educational opportunity, whether that be like a camp or a college campus visit. There's a lot of different educational-based activities that are out there outside the community. Sometimes it costs gas to get there. Sometimes it's, a 2-day event where you need some help paying for lodging. Whatever those costs might be, feel free to check out the academic development program by going to our website, again, at hochunkinc.com. And those are the updates that I have on Ho Chunk Inc. And before I close, I also want to do one last special shout out to the Angel Decorah Museum that we have located on Little Creek Tribal College campus. I recently took a tour there with some of my colleagues, and it was very enlightening. And I feel like a lot of the community members here don't know that the museum is even there, and also the stories that are told. It was very enlightening. Even as a tribal member myself, I learned a lot, and it impacts you, and I think it helps give you perspective in your line of work, whatever you do in Winnebago. If you go to that tour, it'll help you. It's very humbling, it's very eye-opening, and it helps give you some perspective to the job that you do if you work here in Winnebago. So I just want to do a special shout out and promote the Angel Decorah Museum. Go and call Sunshine Bear and sign up for a tour. So those are the updates that I have and the shout outs that I have. And I just want to say, Pinagigi, thank you, Emily, for the opportunity to share.
Thank you, Willie. That was very informative, and we appreciate you and Ho Chunk Inc. Joining us every month and giving us super helpful information on the opportunities and information from the community members as well. So thank you. And last but not least, we're going to wrap this up by discussing and announcing the Youth COVID-19 Winnebago Art Contest that we just announced this week and launched in conjunction with the Winnebago Indian News and the Winnebago Tribe of Nebraska. So we're inviting any of the Winnebago tribal youth and community members who are ages 5 to 19 to submit a drawing focused on COVID-19 vaccinations. It could be a drawing, a painting, a design you do on the computer. You have pretty creative control. It just has to be a 8.5 by 11 sheet of paper. You can email it to tyler.snake@winnebagotribe.com, or you can turn it into the Winnebago Public School or St. Augustine offices as well, and then we'll make sure it gets back to us. But we are taking submissions to the contest entries and encouraging all the youth to participate. There will be 2 different categories, one category of 5 to 11-year-olds and a second category for 12 to 19-year-olds. And we're giving away really great prizes for the winners. All of the contest entries will be posted on the tribal's Facebook page, the Winnebago Tribe of Nebraska's Facebook page. And they'll have 2 weeks, and the winners with the most likes on the Facebook page will win. First prize in each category will get an Apple iPad mini, which is pretty great. Second prize for each category will get Beats headphones, and third place will get an art set too. So really encouraging, hopefully, any art students to submit your designs on COVID-19 vaccinations and have them submitted and sent to us and participate. So it's a really great contest. If you want more information, check out the flyer that's on the Winnebago Indian News Facebook page, or it's also on the Winnebago Tribe of Nebraska and the Hospital and Health Department's Facebook pages as well. So check that out. If you know any youth, suggest that they participate, and we'll see. We've already got a couple great contest entries, and we can't wait to see what other contest entries we get to in the next 2 weeks. So thank you all for joining us today, and we look forward to seeing you in December. We wish you all a safe and healthy holiday season. We'll see you guys next month. Thank you.
Thank you.